Hi, it's Nancy, the nurse practitioner, and I'm here to do a video today on colon cancer. So I don't know what you did for your birthday, but for my birthday, I went for colonoscopy. I know it doesn't sound like a great birthday present, but actually it is, because one thing that I don't want to have is colon cancer. And if I can prevent some major illness in my lifetime by having it done as a present on my birthday, it's a good thing. So I'm going to take you through some information that I've gathered for you. And I want to just tell you that March is Colon Cancer Awareness Month, but really every month should be colon cancer awareness. And it also is colon cancer is the third most common cause of death in the US. So that's no joke. And I just want to make sure that you knew that it is important to have a colonoscopy. And I know many of you were squeamish and maybe babies about getting a colonoscopy. So we're going to go over a whole bunch of stuff today. We are going to talk about who is at risk for colon cancer symptoms, protective factors against colon cancer, screening tests and guidelines from American Cancer Society, and what are colon polyps all about. And we'll also talk about those people out there who do not have insurance and how they can get reduced testing and maybe some free testing from some facilities. So I first want to show you some pictures. I have this really cool book that I got and I use a lot with my patients. And I want to show you what the colon looks like. So when you go for a colonoscopy, here's the rectum, and this is the sigmoid colon. Goes right like this, like an S. That's the descending colon that comes around and up. And then here's the transverse colon. And then here's the right side, or the ascending colon. And then this is the small intestines here. And we're going to show where the scope goes and how that all works. But I just want to show you how much space is in your abdomen where your big colon is. Now, when we talk about the colon, the right side is where we have our major absorption of water, which is here. And on the left side is where the solid waste is formed and it's pushed down through the rectum and out through the anus, which is here. Okay. So just wanted you to be able to see that. We're going to quick share my screen on my PowerPoint so you could see some information that we should be going over. So first we're going to go over who is at risk for colon cancer. Well, it's your first and second degree relatives, including your aunts and uncles, your family history of colon polyps, smokers, having had Crohn's disease or having it, and ulcerative colitis, obesity, and drinking alcohol heavily can all cause colon cancer. Now I'm going to stop and tell you a quick little story. I've been vaccinating in the state of Connecticut, and a young man came up to me and he told me that he had, when I asked him if he was on any immunosuppressant medications at this time when he's getting the shot, he told me that he just got over treatment for colon cancer. He's 37. He had a resection of his colon, descending colon, and he went through chemotherapy and he's all done now. And it turned out he had this large polyp that was just about to invade into the abdominal cavity. And he was lucky enough to have some symptoms. I believe he was having some bleeding from the rectum, went to the doctor, got tested, and sure enough, he had a colonoscopy and they found this. And because he was only 37, he told his family, and his brother was 38, and he went and had a colonoscopy. He was 1 year older, and they found a large 10 millimeter polyp. It was really large. It was about to invade the wall. They told this particular guy that it's a good thing he got here because this was about to turn into a advanced cancer, and he would have been gone in about 6 months. So they started talking about their family history with their brothers and sisters, and they found that Uncle Larry died of lung cancer at 58, and they all thought all these years that it was just lung cancer that was what killed him. But when they went back, they found out that the primary site was the colon. So when you think about asking family members and having this talk once a year about what you've been through, you could really find out a lot of information. This landed up causing his family all to get colonoscopies at 10 years earlier. His children will be having them by the time they're 25. So you can see what this does to the dynamics of health in one family. Now, I have a family member with Crohn's disease. She's young and she's had it since she was 7, and she's been on Humira. So she has to have her colonoscopies regularly too, and she's been having them since she was 7. So that's pretty important. And as you can see, smoking doesn't seem to do much for anybody for any reason. There's really nothing good about it. And as far as family history of colon polyps, I have a family history of it. I've had them. My brothers have had them. And I have a twin sister, and she's never had a colonoscopy yet because she has no health insurance. And we're going to go over some concerns for her later. So let's go into symptoms of colon cancer. There's no actual symptoms. Diarrhea, constipation, narrowing stools, and changing your bowel pattern. Let's say you go to the bathroom every day, you have no problems, and then all of a sudden you don't go for a week and it keeps going on like that. Or nonstop diarrhea is another concern. So if there's a change in your bowel patterns, and you should know what they are, it's a good idea to look in the toilet and see what your stool looks like every now and then. Is there blood on it? Is it black tarry stool? Is it thin like a pencil? What does your stool look like? You may have a feeling like you have to have an urge to move your bowels, but there's nothing coming out. We talked about bleeding or rectal bleeding. The dark stools we talked about, which you may see microscopic bleeding, which you wouldn't see in the stool when you look at it. It looks brown, but we'll be going over testing that you can do to look for microscopic bleeding. Abdominal cramping that just doesn't go away, and just unexplained weight loss. So just so you know, the American Cancer Society has moved colonoscopies back to 45 years of age from 50. People with breast cancer have a 10% risk of colon polyps and colon cancer. So they need to start at 45 years of age. There's a test called 23andMe, and I think a lot of you may know about that test. It's a genetic test that you can do, and it can show genetic mutations for colon polyp formation and colon cancer. So not only is it to find out a relative from faraway countries, but it also tells about your genetic makeup. And I will tell you, interestingly enough, my daughter went for genetic testing. We found some things happening with her as to why her cholesterol is high, and is also the reason genetically why mine is high, because she got tested and we found that out. And that will be on another video. But I'm just saying, genetic testing can do a lot for you. So moving on, we'll talk now about the protective factors. We know that a diet low in fat, high in fiber is important. I carry nuts and grains in my car because I get hungry a lot. So it has like apricots and dates. Of course, I put in chunks of chocolate, and it has almonds and cashews. And, I just have a handful in the car, and I usually have a handful every day. And it's really nice to have it. And I know I'm getting some good high fiber nuts and stuff. There has been some discussion that a daily baby aspirin, 81 milligram aspirin, has been linked with reducing polyps. It's not been FDA approved, but it has been brought up. Exercise. Hey, exercise just means getting out in the yard and raking, picking weeds, walking, lifting things, whatever you want to do, it, keep it moving. And they also talk about vitamin D. Vitamin D has been linked to a lot of protective factors, and having a level of at least 50 or higher may have a real positive impact on preventing colon polyps and colon cancer, as well as folic acid and calcium. And last but not least is the screening. You got to be screened. And there's many ways that you could be screened. So we're going to go over that. Now, when you go see your doctor, we want to know about choosing the right test. So here's the first thing we talked about is when you go see your doctor for a physical, and we're talking about when should you get your first colonoscopy or be tested. Do you have family history of colorectal cancer or polyps? If there's a yes, or personal history of inflammatory bowel disease, yes, colonoscopy is recommended, and it should be started before the age of 50. And based on the age, like my relative, she's been having colonoscopies regularly. She's had probably 15 already, and she's only 21. Well, maybe not 15, maybe 10. But anyway, she's had a lot. Okay, so that's the first thing. If no, there is no family history of colon cancer, and are you age 50 to 70 years old, 75 years of age, they will decide which test is best to use. So we're going to go into that more. So there's a new ranking of colorectal cancer screening tests out there, and this is an update from the U.S. Multi-Society Task Force on Colorectal Cancer, and there's 3 tiers. The option 1 is to have a colonoscopy every 10 years and the annual FIT test. Tier 2 option is you can have a CT colonography every 5 years, and we're going to go over exactly what that test is like. A flexible sigmoidoscopy every 5 to 10 years, or a FIT fecal DNA test every 3 years. And the third tier option is a capsule colonoscopy every 5 years. Okay, so maybe we'll just stop for a minute and talk about these tests. FIT stands for fecal immunochemical test. It's one of the earliest, if not the earliest, signs of colon cancer tests. The pros is that it's non-invasive, it's inexpensive, it has no risks, and you can do it in your own home. And it can show colon cancer up to 2 years earlier than a colonoscopy alone. But the con is if you need further investigation because the test is positive, it could be due to inflammation or ulcers or hemorrhoids or medical conditions that cause some blood in your stool. So you could have a positive FIT test and it can be like a little bit of a chase at figuring out why it's positive. But the one thing that's good about it is you also know the results right away. And then you're going to need a colonoscopy anyway. Okay, there's another test called a Cologuard, and I think you guys seen it. It's a box dancing in your bathroom. And it's a Cologuard test, combined DNA and blood stool test. So there's 2 things in it, a DNA test too. And it was approved by the FDA in 2014. It has 11 distinct biomarkers and the presence of occult hemoglobin in the human stool. So the important thing about that is that you put your stool in the box and you mail it away. Now, the Cologuard screen, the nice thing about it is there's no dietary prep. You don't have to do anything. It's less expensive than the invasive test of a colonoscopy. So some people like that. A colonoscopy won't be needed, though, if the test is positive. And studies have not yet been done to show the benefits and the risks of long-term use of Cologuard. Inflammation, ulcers, hemorrhoids, and medical conditions can cause blood to be present in the stool, which sometimes leads to false positives. So we're going to go on to the next test, and that would be, let's talk about the flexible sigmoid test. I think I'm going to take you in further down to these tests and see more. Well, we talked about the American Cancer Society has moved the age to 45, and we talked about the FIT test. A sigmoidoscopy is a tube that's put in the rectum, and it only goes up the left side. And we talked about the 23andMe test. Now, this is what a flexible colonoscope looks like, and this is what's used during the colonoscopy. And what they do with this particular tube is it goes up through the rectum and around, like we showed, and it has a snare that comes out. It actually can grab that polyp and cut it off. And the most common removal technique is that. It takes pictures. It has water that pushes the debris away. And the polyps are not cancerous when they're found, but they can become cancerous over time, so they need to be removed. Polyps do not have nerves, so they do not hurt to have them taken out. You take a day off from work, you have someone drive you home because you're not allowed to drive home from a colonoscopy by yourself, and you may have some bleeding for a day or 2. So if fever occurs, abdominal pain or cramping persists, you need to call your doctor. So that's a typical thing. This is a nice clean colon after prep. And, taking a prep is not all that bad. I know this looks kind of gross, but just think about if this was full of stool and how hard it would be for the doctor to be able to see around there for polyps or anything. The tissue's all smooth. There's no signs of any growth of anything. And now we're going to go and see what a polyp looks like. This is a little polyp here, which was found, and it was removed by that snare. So it's important to know that that would be something that you want to have taken off. Now, this particular polyp was benign, but you don't know in time. And I have a history of polyps, and so every 3 to 5 years I go have a colonoscopy to remove them. And every time I go, there's a polyp. So it takes about 10 years to grow a polyp. However, some grow faster than others. And once you find one in 5 years, the next time you better go before 5 years. So it's kind of depending on what the doctor finds and the testing results. And this is actually a hemorrhoid. This is actually the tube going in. So this is just some pictures of what a hemorrhoid would look like. Okay. And I just want to go over some more things about the polyp. Let's just go back to this one for a minute. We talked about an adenoma. It's a precancerous polyp. It's slow growing. And colon polyps are tiny growths. They form on the inside of the large intestines, also known as the colon. Polyps are very common. They're roughly 1/3 to 1/2 of all adults will have them. They do not usually cause symptoms. Some polyps can become cancerous. What are the symptoms of colon polyps? There are usually no symptoms. How do doctors find them? We talked about a colonoscopy and through screening tests determining if you need to have a snare and removing them. How are they treated? The doctors remove them with these tools that I showed you and snipping them off with a biopsy forceps, and it doesn't hurt. When the polyps are removed, they are sent out to testing and see what exactly was found, making sure that they're not cancerous. Looks like that's what a clean colon looks like. Is that great? So this is a result of a test for a transverse colon polyp, and this showed where exactly the polyp was, and it's a report that the person would get. And what's good about that is it actually shows you exactly where they found it. So you could tell by some of the tests that I showed you that, you know, the sigmoid test only goes up to here, and a barium enema only does the right side. And we're going to talk a little bit about that. So what happens if you have something in the transverse colon? You would never find it unless you did a colonoscopy. So just want to go over a couple more things. We should go over the video capsule. The video capsule is a little capsule that you swallow. You do have to do a prep the night before, and then you swallow the capsule and the doctor watches the capsule move through and takes pictures of the intestines. It's not very invasive, but if they find a polyp, here you go again. You got to go back and have a colonoscopy. So we're all leading to the colonoscopy as the end result here. That's called the virtual colonoscopy. Then there's the double contrast barium enema we talked about is on the right side only, and it's an X-ray test, so you're going to have some radiation there, and that is the con. It's less expensive than a colonoscopy, and during the test, though, a thin tube is put into the rectum, and both the barium sulfate, a chalky liquid, is put in, and air is pumped in. Now, the con, we said, is it requires cleansing, and if polyps are found, the doctor will have to do a colonoscopy anyway. The CT virtual colonoscopy is also a small tube. It goes into the rectum, and the bowel has to be cleaned. It shows 2D and 3D pictures. It takes about 10 minutes. It's non-invasive. Well, it's not. The pro is it takes about 10 minutes, and unlike a colonoscopy, this test is non-invasive. But for the con is, it's expensive and requires a bowel preparation. So polyps are found, a colonoscopy is needed. So here we go again, and there is some radiation, so it doesn't come without other risks. And then there's the FOBT, or the stool blood test, which is guaiac-based. This one's sent to the lab when you swab the stool on the card, and this can be done in the doctor's office before you leave. It's inexpensive, it's convenient, so that's the pros. And the con is, you know, because it's a FOBT or guaiac-based test, it doesn't take long to do. But the problem is it could be a false positive, and then again, you're chasing why is there a positive test. So there's a lot of different tests out there that can be done. The question is, it seems that we're all leading to the colonoscopy as the #1 test to really see if there's anything in the colon. And I know everybody's scared about doing these because they don't think they're so fun, but I will tell you, this was the kit that I used. It was called the Plenview. Looked like this, came in a box, cost like $25. And this was the size of the bottle that I had to fill up. I know it looks big, but it's not that big. I had to fill it to the line, and I had a bunch of different choices. I could put a pouch in, I could do 2-day split dosing, a 1-day morning dosing. You know, you can't drink alcohol, milk, or anything colored red or purple, or any foods that have pulp. I decided the day before to make it all clear liquids, clear broths, water, black tea, coffee without milk, watered down diluted fruit juices. I had a lot of Jello, popsicles, lemonade, and I'll tell you, the day went really fast. And then I drank this, and I went for the colonoscopy, and I was squeaky clean. Test went really well. So the guidelines for screening, it has been found that the Black and white population, everyone should be having a colonoscopy at 45. Okay, it's been changed from 50. And if you have bigger polyps found, you're going to be going earlier. 10 years before in the family, if they're 50, then that means 45. This man that was 37, his children will be getting it on 27, their first colonoscopy. So you can see 10 years before the diagnosis in the family is when everybody starts going to get the colonoscopy 10 years before that. And we talked about ulcerative colitis. Every 8 years, they need to have a colonoscopy, if not sooner, if they found inflammation. Okay. And for those who do not have insurance, you know, you can call the American Cancer Society and see what you can do, because including breast screenings, stools could be tested for blood, but they are also indicating that we can stop getting a colonoscopy at the age of 75. But that depends on if you discuss it with your healthcare practitioner. If you're still riding a bicycle and you're doing all these things and you do have colon polyps in the family, you could keep going with having a colonoscopy. The Cologuard is covered by Medicare. It covers up to 83 or maybe 85 years of age. And of course, Medicare will also cover, and many other insurances, screening for colon cancer. So you can also, like I said, call the American Cancer Society. You can look into charity care in your local hospital where they do breast cancer screening. At least get some kind of screening, at least something every year that may lead you to the colonoscopy. So you need to do something right for yourself on this. Colonoscopies are not that bad. My drink was sweet, sweet, sweet. And then at the end it was salty, which made me drink tons of water, which was very interesting. So I found it to be very helpful to help, you know, me drink as much as I could to get the job done. And it was a pleasant experience to do on my birthday. It was a birthday present for myself. Yeah, I had a polyp, but I'm glad that they found it. So from Nancy, the nurse practitioner on Caregiver Success, I'm glad you joined me on this video about colonoscopy and colon care. Please check out my book, Caregiver Success. It's on www.caregiversuccess.com. It's all full of stuff that you can use because, you know, mom moves in, but she doesn't come with instructions. And if you like my videos, please subscribe to my channel, Caregiver Success. Stay well, everyone. Take care of yourselves, and I'll see you at the next video. Bye now.